people are standing there looking with maybe with wonder, maybe with admiration, maybe with fear, but they are standing there and looking at these procedures, wondering how is the patient maybe is feeling and what they are going through. زي ما انتم شايفين in the initial pictures in the past ما كان في any technique يعني the procedure is done just randomly, but you can see later on with some of the يعني scholars, if you would, in health, in medicine, started to develop some techniques. If you can see here in the other picture, the patient is sitting in a certain way so that his hands will not be going all over the place. Also, the technique included that the patient will hold to the belt of the practitioner so that there will be better control of the surroundings. But if we go back really to the origin, oral surgery was there from the beginning of medicine as we know it, from the times of Hippocrates, Aristotle. These are the fathers of medicine and surgery. They adopted and they proposed and they basically developed a lot of the techniques that has to do with the care of the oral cavity and the jaws and the dentition. And in those days, as we'll see, until very recently, there was no separation between medicine and dentistry. The healthcare practitioner will be doing all, and they actually, as I said, developed some techniques that pertains to the dentition and the jaws and the bones. And in their days, actually, surgery was very much appreciated and respected. There was special sterile techniques to handle the instruments, special infection control measures. But with the passing of their civilization, that technique was lost, actually. And what happened is that something new developed in Europe, which what they refer to as the Middle Ages, that led to the beginning of a new profession that was widespread, actually, especially in England and France, but all of Europe, which they refer to as the barber surgeon. الحلاق هو نفسه اللي هيقوم ببعض procedures, the surgical procedures that have to do with health, including also oral and jaw surgeries. والسبب كان إنه physicians at that time started to look down at surgery. They didn't really appreciate, they thought of it as something that is not clean, something that is not worthy of their time or of their skills. So even if something is done with a physician in the room, they will call a barber or any other worker and tell them what to do. Cut from here, move from there. So they were not practicing surgery. And as I mentioned, that was mainly in Europe during the Middle Ages. And that was the trend. People looked down at surgery at that time. And maybe one thing I skipped to mention in the beginning, which is important just to understand the root of the word surgery, and probably most of you know, surgery is derived from a root in the word in Greek, or Latin, excuse me, which means to work with your hands. That's basically the origin of the word, the origin of the meaning. And keep that in mind, because when I start to talk about the cross, if you would, the intersection between medicine and dentistry, we'll have to come back to this again. But surgery, which is in the name of the profession, has to do with working with your hand and the manual skills involved. So in that phase, people looked down on it until this man came, actually, and he changed really the practice all over the world. اسمه أبو القاسم الزهراوي, معروف في English literature بأبو القاسس. He is actually an Arabian Andalusian physician. He is the first to develop surgery, really. He had a whole book and a chapter dedicated for surgical techniques. He had so many instruments that he proposed, or what we call in our days patents. He developed so many instruments. He's actually the one also who developed the scalers that you are using until now. A lot of the instruments he proposed are just modified a little bit in a more modern way and used until our days. This guy is truly, without question, the father of surgery. And there's so many quotes, I skipped it here for the time's sake, but in Europe, if you go through the literature, you'll find that the father of surgery, they refer to a French surgeon. Dicholiac, I believe his name is. So he is the origin, if you would, of surgery in Europe. His book came about more than 200 years after the time of Abu al-Qasim, and he quoted his techniques. He quoted Abu al-Qasim techniques and instruments more than 200 times in his book. Most of you may be familiar with the research. You'll know that if we quote a paper from 50 or 30 years ago, we consider that just for historical perspective, really. It has no pertinent value anymore in the practice in our days. So he quoted him over 200 times, and he wrote all what he wrote 200 years before. And in actually honest references, they refer to him, and I have those references, they refer to him as the true father of surgery. So he's recognized even in the West, in the literature, that he is the father of surgery. Even in his days, there was no separation between medicine and dentistry. This is something that is actually considered recent, as I will talk about it now. I like to mention here one example, though. I think one of the key features of the profession, one of the distinguishing features of the profession, is the fact that it's in the middle of these two worlds. And in our biased opinion, I have to say, it's capturing the best of the two worlds. So as we mentioned before, that it's surgery at the end. And there's other surgical professions under the medical fields. However, what maxillofacial surgeons are blessed with, if you would, is that throughout those 6 years of graduate training and education, they get to master their skills basically up to the level of almost the 1 and 2 millimeters. So throughout those years, they are building something that is the basis of surgery that they will continue doing throughout their career. On the other hand, some of the colleagues in the medical schools, by the time they finish, the exposure, the amount of skills mastered is not definitely up to the same level in the graduate. Yes, they go ahead to postgraduate surgical training, and they master their skills and the techniques that they need. But the fact of the matter is that for oral maxillofacial surgeons to be equipped with that skill from early on is a big, I think, advantage for those in the field. And on the other hand, also, our colleagues know that in most dental schools and dental hospitals, usually those in charge of the medical emergencies and the medical situations or protocols in the hospital end up being from the maxillofacial surgery field, just because our training and our exposure get us to be familiar with those areas. Part of our training, at least 12 to 14 months, include training in different surgical disciplines like internal medicine, general surgery, emergency room, ICU, and so on, which is something that we need even in our practice. In the States, actually, the oral maxillofacial surgeons do anesthesia, do general anesthesia in the clinic. That's part of the profession, as we will come across later on. So that sounds like an advantage, but it's definitely a disadvantage also. طبعا, I can use so many examples. Does someone have a question? I can use so many examples to talk about advantages and disadvantages and how the fact that we're in between two worlds. But there's one example that I found went through, actually. It's not something I found out. I went through it myself, me and my colleagues, a few years ago. And I think it shows this point very well without the need for any examples or any literature. A few years ago, if you all remember, we had to change the weekend in the country from الخميس والجمعة للجمعة والسبت. So what happened in the dental school? The dental school decided, if I remember correctly, to move the whole week one day down the schedule. So اللي كان يصير السبت صار يصير الأحد، اللي كان يصير الأحد صار يصير الاثنين. And they pushed the whole schedule one day. So everyone had their schedule sorted out, their clinics, their teaching, their other obligation, everything is sorted out. But what did the medical school do? What they decided to do is that they moved what used to be done on Saturday to Thursday. So Sunday, Monday, Tuesday, and Wednesday remained the same, and Thursday was the day of those who used to work on Saturday. So as you can see, their matters and their affairs were sorted out. الوحيدين اللي if you would هنا دخلوا في الجدر أو اتلخبط كل جدولهم هم الماكسيلوفيشال surgeons only. لأنه عندنا جدول في الدنتال school and we have obligations there. وعندنا جدول في الhospital which is under the medical school and we have our obligations there. So it just shows that this is the nature of the profession. So sometimes it's an advantage, maybe when it comes to the skills and the knowledge in some aspects in the field that we're practicing. But on the other hand, it's definitely a disadvantage logistically, administratively, And the examples on that are so many. As I said, it's not time to talk about that now. The key point is that it is something that is part of the fact of the profession. And it's important to know because we'll come to it when we talk about the literature in a second. This is one of the factors why the identity of maxillofacial surgery is affected. Right, let's go through the contemporary history now. So it's just important to know that up until the early 1800s, there was no dental schools really. As I told you, until relatively recently, there was no separation between the two professions. The first dental school really was the Baltimore Dental College. It was in 1840. And remember this date because just shortly after that came about the discovery of ether anesthesia or general anesthesia. William Morton, he's a Boston-based dentist. He graduated from the Baltimore Dental College, which was in 1840. This actually breakthrough happened in 1846, so a few years after he graduated. The first, at least publicly announced and documented demonstration of general anesthesia was in the Harvard building, Harvard Medical School. And it was actually done, the anesthesia was done by William Morton. He published a paper on using ether to do an extraction procedure, and the patient went through it without any difficulty or pain. This is one of the most famous portraits of the first procedure in the Harvard Medical School. So William Morton was there. He was administering the anesthesia while a surgeon actually was doing, again, surgery in the submandibular region. So even the first surgery credited with this discovery is actually done in the maxillofacial region. And yeah, we have to know that this discovery of ether anesthesia was coined as the most significant discovery in basically for mankind. You think about it, people until that time used to, basically there was no good practice of surgery. Surgeons at that time had to move very fast in the procedure because of the severe pain the patients are going through, as well as because of the bleeding that they couldn't control, and they will lose patients frequently, no infection control measures. So surgery was very underdeveloped, a lot of diseases, patients were dying from it. This discovery opened the door to something that was definitely, I agree, and I think it's one of the greatest breakthroughs in the history of healthcare, this discovery of general anesthesia. And it was by actually William Morton. So, and the first surgery was a surgery in the submandibular region. Type. Later on, I'm just quoting this from one of the papers. Harvard opened the first medical school and university affiliated dental school. This is one thing about we love our colleagues from Harvard, but this is one thing that those graduates from the school there tend to do. They always like to take the credit for the first this and first that. This paper actually mentioned the Baltimore Dental College later on in the paper. Just to mention that that was a separate, not affiliated with a hospital or not affiliated with a medical school. I guess just to use the word first. But the key point here is that they started to open more and more dental schools. And that's when the profession started to go through the different stages of development. So what are those stages? First, initially, as you know, more and more practitioners graduated from dental schools and they focused their practice on oral surgery. Initially, there was the American Society of Exodontists, they called it. Then they called it American Society of Exodontists and Oral Surgeons. Later, it was named the American Society of Oral Surgeons because the practice just kept on expanding. Up until 1985, which our society was, or our name basically came into the field or into the medical field, and that is American Association of Oral and Maxillofacial Surgeons, which that association stands until today. Okay, so that's just part of the history, but there's one very important aspect that I cannot skip, and even maybe when I give the trauma lecture for our students, I give a few minutes to talk about this, because trauma and our contribution to trauma was one of the greatest factors in developing and recognizing the profession. Well, actually, basically, when World War came and physicians had to deal with these new types of injuries from the new ballistics and the new weapons that are used, general surgeons were not equipped to deal with it. They didn't just have that background to know how to deal with such injuries, especially in the head and neck area. But the oral surgeons actually, because they combine the knowledge of the occlusion, the knowledge of the maxillofacial anatomy and the head and neck anatomy, along with their understanding of different materials and biology and physiology, they managed to develop techniques that no one basically had or proposed before. And they definitely, that was one of the greatest, basically, if you would, advances that happened in the profession, which was after the World War, because that experience came in handy and all the medical professions recognized that. Keep in mind that by that time, there was no such thing as plastic surgery also. So all these professions who deal with this area just didn't exist. So that was one of the greatest contribution in the area. And by the way, today, all over the world, in order for any hospital to be classified as a level 1 trauma center, they need to have a maxillofacial surgery on call. They have to have that practitioner as one of the members of the team. Part of the progression in 2016, actually, we were able also to apply, and we're probably the latest surgery profession to be able to do that, to be certified by the Fellowship of American College of Surgeons. ACS, an American College of Surgeons, this is the umbrella under which all surgical professions fall under, all of them. And only very recently, in which the door was open for graduates of maxillofacial surgeons because of their constant contribution to healthcare and hospitals in general, that it was recognized as one of the surgical professions. And this has nothing to do with whether that practitioner have a general surgery training or an MD certificate or not. If that practitioner is a maxillofacial surgeon, board certified, or have the certificate for that, then they are qualified to go into the fellowship. The fellowship is just a certificate, ما هي training عشان you don't confuse the words. طيب نيجي لنقطة ثانية بس في contemporary history. طبعا parameters of care. كل profession لها parameters of care that we need to be familiar about. تمام. And I'm not going to go over it here, but this is something that I did a few months ago for our residents, just to show the full scope and so that they will not skip or miss any of the aspects of the profession. As I mentioned before, anesthesia in the States, we do our own anesthesia in the clinic. We're licensed to do that. We have all the medications and the equipment, and we are trained how to use them. Unfortunately, it's not the case here until now in Saudi Arabia. I don't think it's going to be happening anytime soon, mainly because of the narcotics control, the narcotic drugs control, and the fact that it needs very close monitoring. But there are 12 to 13 parameters of care under maxillofacial surgery. Anesthesia being the first one. Again, because even all of you in dental school know that this course is usually given by the maxillofacial surgery department. Then we have the dental alveolar practice. Then we have implant surgery. We have cleft and craniofacial, cosmetic surgery, microneurosurgery, which was now divided or developed as a separate parameter of care. It used to be under reconstructive surgery, but just proposed as a separate parameter of care. Infections obviously is a very important aspect of the care of the profession. And a lot of infections cannot be managed, and those patients' life will be compromised if there's no oral maxillofacial surgeon in the hospital settings. Trauma, as I said before, it's one of the most important aspects in our field, and very important. It's the core practice for any oral and maxillofacial surgeons, along with some of the other disciplines that I mentioned. Pathology also, from benign all the way to malignant aspects are under the profession. Patient assessment is what I mentioned about before, which is it's a vital part of our training. So usually in most of the dental schools and dental hospitals, the maxillofacial surgeons are considered references for how to deal with these patients with medically compromised conditions because of the nature of our training. Orthognathic surgery, also a very important and unique feature, if you would, of the profession. So when it comes to trauma in the maxillofacial area, in some hospitals, it's covered by plastic surgery and ENT, and sometimes there's a rotation between us and them. So they have exposure to that field. But when it comes to orthognathic surgery, I think very few places in the world do plastic surgeons do it, but it's basically unique to us, if you would. It's not something that any other profession would do. And it's a unique procedure used for so many things, not just for deformities for patients with either retrognathic or prognathic jaws with smaller or larger jaws. It's also treated for treatment of other diseases like sleep apnea and so on. TMJ disorders, مشاكل الفك الصدغي, we are trained in it, and there's a full scope of dealing with the conservative as well as the surgical options. Yes, there are professionals who deal with the conservative options, and they are well versed and well trained in that, but there's just not enough of those practitioners all over the world. I'm talking not in our country, even in the States. So it's kind of known that in the States for TMJ problems, maxillofacial surgeons are the one covering that area and helping the patients on that front. I just mentioned obstructive sleep apnea. It's something that is now considered one of the parameters of care, surgical treatment for those patients. So that's a quick review on the profession, and I just want to now go over the training programs, including some historical perspective on it, because that's what, honestly, that's one of the areas where the confusion happens. And that's one of the areas why our profession identity is affected. As I said before, it's in the middle of two worlds, so politically it doesn't have the strength or the power of either world, just to, without elaborating much on that, but that's just the fact of the profession. But the other fact is that it's so much different in so many different places, and it is confusing. And I'm talking about someone who went through that confusion myself. I used to think of maxillofacial surgery when I was a student in a certain way. When I graduated, I found something else completely different. And then I found that it's different in other places and so on. And that creates confusion around the profession. So I hope this review also will give you an idea about that, so it will not lead to any confusion. زي ما قلنا احنا كانت السكولز يعني rare والsociety developed slowly. Most programs in the initial beginning of the last century كانت 2 years. 1 year كان maxillofacial internship, they call it, so they have to work and practice. Someone open the mic يا جماعة. ف 2 years واحدة OMFS training, والثانية كانت they repeat another basically some of the important basic sciences to the practice like anatomy, especially anatomy and physiology. بعدين في اللي هو American Society of Oral Surgeons, if you remember, كانت في 60s, they proposed 3 years, a program composed of 3 years. سنة internship في maxillofacial surgery, so زي طبيب مقيم، يعني المرحلة الأولى زي intern عندنا نسميه في maxillofacial surgery. They're doing the full scope and the full basically coverage of the practice. بعد كده 1 year hospital rotations زي ما قلنا أول medicine, surgery, anesthesia, trauma, different surgical professions, and finally a third year اللي هو كأنه advanced residency training. Basically they're doing the advanced cases, they're supervising the residents, they're applying that knowledge and those skills in the different fields and the different parameters of care اللي تكلمنا عنها. أول مرة ينضاف الميديكال سكول في التريننج كان فعلا في هارفارد في 1970, and they initially combined not just the medical degree, but for them it was important to add 1 year of general surgery training. In the States, in order to practice under the medical license, the individual need to have at least 1 year of general surgery training. Without it, they can have the MD, it's a certificate, but they cannot practice underneath that certificate. And the head of the Harvard at that time, when he proposed it, the goal was to have this 1 year of general surgery training to give them the full scope of dealing with the different aspects of surgery, bleeding, infection, how to manage emergencies, and so on. In 1985 فاكرين هو نفس السنة اللي developed فيها a society that exists until now, American Association of Oral Maxillofaical Surgeons. The training increased to 4 years. That's the first time it started, and that's how it's continuing until now, including 12 to 14 months زي ما قلنا of hospital-based training in the different professions. طيب. نيجي للtraining programs, and you will see now what I mean when I say identity of the profession and how things are so confusing. Just I'm going to go over the different countries and different continents, if you would, and you'll see how every program is different and how it's easily confusing to the students. So in the States, currently, there are 3 separate tracks. First track is what I just mentioned, 4 years of maxillofacial surgery training, including the off-service rotations. and certification in oral and maxillofacial surgery, which makes the candidate eligible to go to the board certification. That's one track. The other track is to go through a combined program from the beginning. So they do 2 years medical school with the rotations in the middle of the program. So it becomes a 6-year program combined with the medical school. That's the second track that individuals and candidates will go through. The third track is for them to finish the medical school, finish their maxillofacial surgery training, and then go through medical school, either by 2 years or more, depending on whether general surgery will be done or not. But that's a separate track that still exists in our field. So as you can see, that's only in one country, in the States. There's 3 separate tracks that individuals can go through. In Canada, I think there's one program, if I'm not mistaken, that have a combined MD. I think the one in Halifax, but I don't know any from our region, any Saudi or any individual from Kuwait or Bahrain who went through that. Most of the programs that our colleagues go through is a 4-year program, similar to the one in the States, but they have an advantage of having it combined with a master's degree. I think most of the programs that I know there that individuals go through have a combined master's degree that they dedicate, I think, some time to during the training in some courses and research, and it has to be submitted before the graduation. But it's a 4-year program, roughly, in most of the programs in which we can apply from our region. In Saudi Arabia, we have also different programs. We have the classic Saudi board in oral maxillofacial surgery. That is the program equivalent to the American and Canadian programs. In our country here, it's 5 years. It's it's not 4 years. It's not 6 also. It doesn't combine an MD, but it's 5 years. The first year is dedicated to a lot of the courses, basic science courses, and the internship, if you would, work in maxillofacial surgery, and then 4 years of training. That is the Saudi board in oral maxillofacial surgery. Those who finish it are qualified to be on track to be consultants. في عندنا few master's degree program in oral maxillofacial surgery. And keep this in mind because as we go to other countries, we'll see how the confusion starts. So master's degree is 3 years. It exists in different programs. I know it's in Jamiat Riyad al-Ilm currently. We are actually in King Abdulaziz University will have our own that will open application this April this year to begin next academic year, inshallah. And they used to have one in King Saud, but they are not using it now because of the PhD. They have a PhD. A key point here is that those graduating with a master will be specialists only, so they cannot reach consultant with that degree currently. PhD there's only one program in the country, which is in King Saud University. It's a 5-year PhD program in oral maxillofacial surgery, and those graduates actually are on track to be consultants, and they receive their credentials and their license from the Hayat al-Takhasusat without the need for a separate exam. They don't need to sit for the Saudi board exam. They are immediately eligible for classification أو التصنيف كنائب أول. So هذه الثلاثة التراكس اللي موجودة عندنا في البلد الآن. And I hope that clarifies it. Let's go to other countries around us. In Egypt, there's 3 also. I guess we might not call it 3, but there's 2 separate tracks. The master degree. So in Egypt, it's working on the way that we're starting to adopt now, which is masters and PhD. They do have an Arab board exam, which I believe the candidate will sit for after finishing the training. But so there's no initially program that's an Arab board you apply to. Maybe some candidates can go through that, but I'm just talking about the majority of the candidates. They will either go through a master degree or a PhD, and then a PhD. And the time varies, as you know, between the master and the PhD. Depends on the candidate and the project and when will it finish. But that's how it is in the surrounding countries, including in Egypt. In South Africa, which I know for one colleague who finished from there, it's actually a very strong program. They do have 2 tracks. It's a 5-year program. So similar to the Saudi board, similar to the American and Canadian board, not much different as far as the years of the study. The parameters of care are all covered over there. They do have one unique feature actually, which I like a lot, being inclined to pathology and having a big part of my focus on it. They dedicate their trainees to go through oral and maxillofacial pathology for a very long time. Actually, I think they spend almost 3 to 4 or 5 months with the oral maxillofacial surgery for a few days of the week. And they are basically required to be able to review slides and read histopathology and so on. So that is their track. And I believe there's another track combined with an MD, but I believe it takes them 4 years to repeat the MD. I don't know if anyone from the Gulf region who went to do that, but the classic track is equivalent to the board. They have a Royal College, similar to the Canadian, that applies, being one of the previous British colonies. So they all have their own Royal College institutions that grants the certification. Like Germany, now this is part of the misconceptions about the profession that even I went through. They have 2 separate programs. I used to think that's how it is all over the world, but that's not the case. But it is in Germany, it is in UK still, which is having 2 separate programs, oral surgery and oral and maxillofacial surgery. So I used to think that's how it was, but that's not the case. As I mentioned, not in our country, at least. We have an oral and maxillofacial surgery specialist, if that's the scope of the training, and a consultant if there's the full scope of the training. In Germany, they divide it into 2 tracks. There's an oral surgery Facharist is equivalent to their board. And my understanding from the colleagues who are training there, they do the full scope. Basically, they do the full scope as an oral maxillofacial surgeon in the States or in Canada or in Saudi Arabia. Their program settings is different, but they are in an oral surgery Facharist program. But that's how it will be classified at the end. For them, oral maxillofacial surgery, their candidates have to go through repeating, they will do the full dental school and the full medical school. So 5 years of medical school, 5 years of dental school, and then 5-6 more years of oral maxillofacial surgery. So that's how it is for the maxillofacial surgeons in Germany. And that's why it's 2 separate training programs. In the UK, it's similar, and they have master degree in oral surgery. So, and it's part of the area where there's also some confusion in the scope of the training between oral surgery and oral maxillofacial surgeons. But as I said, it's different. So in the UK, Germany, it's different than in the United States and Canada, at least in the classification. And as you can see, it creates confusion among people to know it. So I hope that was a thorough review for you to know about the different programs and the different tracks. If time allows, inshallah, we'll answer it at the end. OMFS identity. كل profession لها identity. Basically, تعريفها هو stable and enduring constellation of attributes, beliefs, values, and experiences in which people define themselves in a professional role. فمعناته, it's what people feel that the profession, it's not what you do, basically. It's not what is it that they do. It's what is it that they all agree upon as far as values and motives and experiences. So that is the definition of professional identity. It applies to all professions, not just ours. So who are we? Where do we stand in this scope of identity? So again, this is still in the definition, understanding the full scope, a holistic picture of the specialty rather than what they do. And why is that a problem in our field? Because as I just told you before, every place is different, and the recognition of the healthcare field to our profession is not very high. So everyone think about us differently. Everyone think about what we do as differently, and therefore everyone define our profession differently. And that is one of the greatest issues and problems that we have to face. And just as to give another example, here in Saudi Arabia, if you go through all the different maxillofacial surgery departments in the country, حتى in the same sector, let's say the Ministry of Health, هتلاقوا بعض الأقسام مندرجة تحت قسم الأسنان، كتخصص هو من أقسام الأسنان، وفي أقسام أخرى هو مندرج تحت الجراحة، تحت الجراحة العامة كأحد أقسامها، وأتوقع في بعض الأماكن منفصل كقسم مستقل وحده. ما في consistency in the way the profession is being let's say understood. And that's one of the areas affecting the identity. But there's, according to the reports, there's this is out of Britain, I believe. It's basically there's an identity crisis in the profession. Awareness about the specialty, whether in students or healthcare professionals and the public, is considered weak. That's why we're using this opportunity to talk about it. Mainly as the parameters of care and the part of the history. هنا يعني basically they're finding طب ايش what will define it, what is it that we can use, او ايش اللي اتفقوا عليها بعض البراكتيشنرز. بعض الاشياء اللي اتفقوا عليها انه it maybe define our profession هو يعني access to the OR if you would compared to maybe some of the other dental professions, ولكن also acceptance and the willingness to cover and to go through some of the complex cases. هذه طول عمرها كانت part of the nature of the profession, is that part of the challenge is accepting and being focused كprofession على challenging cases. هذه the two findings that came out of this paper that had a greater influence على the identity of those who are in the profession. زي ما قلنا هنا another paper, a lot of papers. Most are unaware about the extent of the profession. So it's a problem that all of us need to work on, my colleagues and myself, as well as those interested in the profession, to help us spread the word and explain what is the profession. Because there's definitely a backlash, if you will. There's definitely consequences for this weak identity that is within the profession, any profession. Like, for example, this paper and 100 dental students, 17% were aware that there's such a thing in the surgical professions called oral maxillofacial surgery. Maybe that's not the case in our colleges, but this is some of the places out there. Another big يعني study that is alarming في UK زي ما قلنا في oral surgery أو في maxillofacial. Maxillofacial, they repeat medical school all over again, another 5 years of medical school. 40% of those who enter the second degree end up doing something other than maxillofacial. So يدخلوا على أساس إنهم حيكملوا maxillofacial بس يقرروا إنهم يغيروا التخصص. واحد الأسباب هو إنه البروجرامز established، البروفيشن معروف هو إيش وإيش السكوب تبعه. فمثلا في التخصصات اللي حولنا المحيطة كبلاستيك أو كENT it's kind of recognized what is their scope. معظم الأماكن التدريب حتلاقوه متشابه، ما في فرق في الاسم، ولو في فرق في التريننج حيكون في فرق في الكلاسيفيكيشن بعدين كسبيشالست ولا كونسلتنت. احنا عندنا اللاينز are so blurry وفي ميكس كبير بينهم وما هي واضحة. Honestly, those of us in the field know how it is. It's just not clear. It's not well defined, not even for us. And it's not to say that يعني, some of these classifications are wrong or no. Some of those people who maybe from the previous, let's say, schools and previous يعني, practices are very well trained, لكن تلاقوا في differences كبيرة في الباكجراوند. بينما in all other professions ما في المشكلة دي ولا في مشكلة في perception in the society. أتوقع أحد أكبر الأسباب اللي بيحولوا من الماكسيلوفيشيال هو that fact إنه the identity of the profession is compromised شوية. هنا في برضو question which يعني they looked into it here إنه هل إذا غيرنا الاسم حيغير ال approach. I actually believe so. Their conclusion هنا إنه لا، إنه they didn't recommend changing the name. It's not advised to change the name. كلمة ماكسيلو صعبة. كلمة ماكسيلو ما هي معروفة عند a lot of people in the field. حتى يعني أشعر بعض الكوليجز اللي في other professions من الهيلث كير من medicine especially يعني الكلمة بتتقال و they feel كأنها medical terminology يعني كأنها something that someone have to learn, or the fact that you're saying it means that you have broader knowledge than others, because الكلمة is not very familiar to a lot of people. I think oral and facial surgery would be more practical, will be more easy to define the profession and improve its identity and recognition. However, this is not where we stand as a society. At least in this paper, they are not recommending changing the name. Yet it's still an interesting profession. Okay, so according to this study, in some other schools, 50% had high levels of interest in pursuing the graduate training. That's a big number. That's half of the students. So all the other half is inclined to other professions. As far as the stress in the profession, it's a known fact actually and established in so many papers that it's the most stressful and demanding of all dental subspecialties. just because of the scope of the care, the fact that the involvement in both clinics and the OR and the emergency room make the scope of the practice more demanding, and therefore has a potential of being more stressful. And that might be one of the reasons why people are maybe inclined or stepping away from the profession. And part of it has to do actually with the compensation زي ما هنشوف الآن, especially بتكلم في الدراسات اللي في الوست. Future of the profession زي ما قلنا احنا, this is what we're doing today, trying to increase the awareness utilizing هذا الانترناشونال داي في 13 فبراير. احنا مستنين برضو ابداعات future generations. الفاكت انه يوم واحد قبل الفالنتاين I'm sure حيكون في some creative ideas in the future on how to market the profession and how to increase awareness about it. As far as the application to the programs for the UK, it's actually being less, as well as in the States. Less and less candidates from the US dental schools are applying to the profession. The key point هناك على الأقل هو because of ما قلنا compensation. في أمريكا basically every practice, it's built on the insurance, and the compensation is actually currently ما هو inclined towards hospital-based difficult cases. Someone can be doing 2, 4, 6-hour cases in the OR, and if they do one case in 20 minutes in the clinic, they might get the same compensation. Procedure in the clinic is easier, فما فيها تبعات قانونية. وانتم عارفين في أمريكا that's a huge problem. It's abused actually, medical legal issues. So for them it's a headache to do these complex cases. So كانوا الدكاترة more and more stepping away from the emergency room, stepping away from the trauma coverage, and just focusing on the clinic practice. طيب, I just need to wrap up here quickly. لكن in the future حتى في الستيتس إنه they're going to compensate based on the extent of the procedure and the outcomes. If you're doing procedure for patients who are actually suffering from bigger problems or greater diseases that request not just a long surgery but also long-term follow-up in the clinic, then that will be built into the compensation. Maybe that will bring patients back. This is just the quotes about academic surgeons, which I will skip for now. Once again, thank you all for your attendance and your presence with us. I hope I managed to summarize the profession, explain it to you, and be glad to answer any questions here or later on at any time. مرة ثانية دكتورة سمر, شكرا لكم ولتنظيمكم للتوك هذه. شكرا جزيلا للجميع. تفضلوا, أنا حاضر لأي questions.
شكرا لك دكتور باسم. الحقيقة محاضرة جدا جميلة وغنية بالمعلومات، ثرية جدا. أعتقد إنه حتى إحنا كأطباء أسنان عندنا a bit of confusion with regards to oral maxillofacial surgery. فهذه kind of put things into perspective. فشكرا شكر ليك، وأترك المجال الآن للحاضرين إنهم يسألوا الأسئلة. ممكن تسألوا عن طريق الشات لو حبيتوا أو عن طريق المايك. تفضلوا. واعتقد ممكن من عندك وممكن تسوي الانميوت للمايك. دكتور باسم حضرتك شايف الشات؟ ايوه، في احد بيسالك هنا دكتور ايش رايك في المانيا كدراسه؟
المعذرة I was on mute, I didn't pay attention. طيب, فبالنسبة للسؤال تبع ألمانيا, I think Almania is one of the strongest schools in healthcare في العالم. كلنا شفنا حتى أثر الشيء ده في بدايته في كورونا. They are one of the most well developed, and I think anything that comes out of them, I personally look at it with almost as something that is going to be accepted in the field. For their schools and their training is strong, no question about it. The only issue about it is how will the society, how will the healthcare ministries in اللي هو هيئة التخصصات, how will they classify the graduates from Germany? إذا أخذوا oral surgery فخرست, حتى وإن كان, وهذا فهمي إنه من اللي بتدربوا هناك بيسووا الفول scope. They do the full scope of oral maxillofacial surgery, the full scope literally. So if they come back with that full scope لكن تصنفوا في البلد ك يعني استشاري oral surgery مو oral maxillofacial، هل حيقدر يمارس الأورثوغناثيك والتروما وبعض التيومرز في المستشفى اللي هو فيها ولا لا based on that classification؟ it's something that might change ولكن I'm not sure how would that affect them. But as far as the training, I think it's a very solid training. You just need to get the language. That's a big important factor for in Germany or حتى France. It's important just to get that to really benefit from the training. أسرع في سؤال عن أضمن وأسرع طريقة للحصول على قبول في البورد السعودي. طبعا يعني أنتم شروط الهيئة يمكن تكونوا familiar بها أكثر مني. في نظام نقاط، جزء منه في اختبار الهيئة، جزء منه في معدلكم، جزء منه في الريسيرش. and I have to say that is unfortunate. I'm against الفاكت إنه يعطوكم نقاط على الريسيرش. I'm just against it 100%. It's not you're not expected to be doing research. Yes, you should be exposed to it definitely, and you should get some experience in that, but you shouldn't be credited points for that. Your role as a student is just to get to know the science as well, to understand the field بما فيها الريسيرش، بس مو تعطى نقطة على الريسيرش. وباختصار أنا هذه للأسف فتحت مجال لسوق سوداء في مجال الأبحاث، which is very unfortunate. I'm sure all of you know about it. بس إنه بالإضافة لطريقة النقاط definitely حاول تحرصوا على إنكم تشتغلوا على papers و research علشان تساعدكم كنقاط. وجزء أساسي حاليا في البروفيشن كثير من اللجان تفضل اللي عنده خلفية 6 شهور وأكثر في قسم جراحة وجه وفكين، ما يكتفوا اللي هو الانترنشيب العامة اللي بتسوي منها 3 شهور أو شهرين اللي هي الجنرال روتيشن اللي بتسويها في آخر الانترنشيب. They would rather يكون عندكم 6 شهور للسنة of exposure to the profession for for to be considered. طبعا I don't agree with that 100%، بس زي ما قلت هذا الانكلينيشن، لأنه أعتبر if we have a good candidate دوبه متخرج من dental school he's a good candidate we will train him. I don't ما هو جاي أنا ما أبغى experience لما يجيني، أنا أبغى to train him to be a good practitioner بعد كده. ولكن الفكرة فيها أحد الأسباب ليش الفكرة دي موجودة هو إنه الناس يدخلوا ما هم عارفين أحيانا إيش التخصص، فهذا the middle of the road يحسوا إنه لا تورطوا تخصص ما هو زي ما يظنوا. إنه العمليات is interesting. Coming with us to the surgery you'll see the procedure, it's interesting, but that's not the profession. For 5 years you'll be in the OR and the ER in the ER almost all the time, being called about so many cases. There's a lifestyle question about it also, whether that fits what you want ولا لا. طيب الدكتور البورد السعودي 5 سنين. If you finish البورد السعودي you're on track to be a consultant، بس أول ما تتصنف اللي متخرج حاصل على البورد السعودي يتصنف كنائب أول لمدة 3 سنوات وبعدها يصير استشاري. البورد المصري Egypt is a very solid school. it's there for years. They have very excellent surgeons and very well developed programs. أنا ما أعرف إذا في شيء اسمه البورد المصري. Maybe this is something new and I remember in some of the meetings ages ago since we've been in meetings, but they were talking about developing and starting something like that. حتى بيقول إنه كيف إنه الهيئة الخليج مع إنه بدأ بعدهم يعتبر ك health care، لكن إنه صار في تقنين لموضوع البوردات والتدريب وفي مكان مركزي لإعطاء الشهادات. فأنا ما أعرف إذا كان في بورد مصري معين في مركز معين، لكن الأنسر in general إنه في مصر في very strong schools و strong surgeons and strong programs, but I just don't know much about it. That it depends on the exposure, complicated cases. لما قلت complicated cases ساعتها ما كنت بتكلم على UK programs. هذيك بيبر عن الايدنتيتي، انه لما سالوا candidates في الماكسيلوفيشال ليش اللي تظنوا انه يوحد الايدنتيتي، الرقم زي ما قلنا في الايدنتيتي كانت شويه ارقامها ما هي مره بوزيتيف، لكن طب ايش الاشياء اللي اتفقوا عليها الاغلبيه هو انه الذهاب للعمليات والرغبه في المشاركه في complicated cases كانت عامل موحد أكبر أو أكثر عدد من الناس اللي شاركوا في الاستبيان ده في حبهم في تخصص جراحة الوجه والفكين. هذا اللي قصدته ب complicated cases. حاليا الأورال سيرجري بروجرام هذه لها تصنيف منفصل في بعض الدول زي ما قلنا في بريطانيا وألمانيا. I don't know how is it gonna happen here. I'm not sure honestly how is it gonna happen here. لسه يعني أنا أذكر حضرنا كم مرة يعني لو كانت كاختبار لبعض اللي بيجوا يعادلوا شهاداتهم وسواها في بريطانيا يعني because we know إنه they have a full scope of practice وفي النهاية يعني they want to focus on it هنا لما نيجوا. ففي أغلب الأحيان كانت يعني رأي دحين لجان فنحضر كلجنة نمتحن مثلا الكانديديت يكون في توصية عامة لكن I don't know إذا في الفيوتشر في السعودية حيكون في separate profession للأورال surgery ولا لا. If any of my colleagues أنا ماني عارف صراحة من الحضور but if anyone has any answer on that let me know. لكن الفكرة هو إنه I'm not inclined to do that يعني we don't want to create more confusion. I think يعني if it's up to us as a profession I would suggest إنه we keep it as oral maxillofacial surgery وحتى اللي جاي ب مثلا oral surgery فخرست ولا عفوا مو الألمانية تحديدا بس جاء بماستر ديجري في oral surgery من بريطانيا حتى لو اسمه oral surgery they get on board as a specialist in oral and maxillofacial surgery. So the profession should be one. We don't want to divide it. We don't want to create more confusion. The question here, does fellowship programs require MD degree in the US? No, it doesn't. Fee programs that does, but fee programs that doesn't. So it's not a mandatory requirement. And a lot of it actually, I think, I'm trying to remember now, all of the Saudi actually practitioners who are here who did their fellowship before they even apply or get the MD. So a lot of programs that is open for us does not mandate an MD. What they mandate is either they call it board certified or eligible in maxillofacial surgery. Are we able to work as maxillofacial surgeons if we specialize like in Jordan or Saudi, in the Middle East? So to work in Europe or the States, what would the process be first? Okay, this is I think a bigger question that I can answer لأنها تختلف من مكان للتاني. فالسؤال basically إنه كيف تصنفوا نفسكم في هذيك الدول. في أمريكا على فكرة شهادة الماكسيلوفيشال surgery is meaningless في البراكتس لأنه هناك يتصنفوا على الدنتال degree. فايفن if you have a top maxillofacial surgery training certificate you will not be able to practice إلا لو كانت يسموها تحت training practice في جامعة مثلا you're just allowed to work under the umbrella of the جامعة كpart of the training لكن من غير dental degree most of the states will not grant you license to practice as a separate individual in those countries. ويمكن هذا له وقت أو له تصنيف آخر ومكان آخر نتكلم فيه. تخصصات دقيقة داخل maxillofacial absolutely ففي عندك معظم اللي رصيتها في parameters of care if you go back to it كلها تخصصات دقيقة. craniofacial وتحتها cleft إذا تخصص دقيق. head and neck or maxillofacial oncology تخصص دقيق. أحيانا البلاستيك اللي هي cosmetic surgery فيها برضو fellowship training. TMJ surgeries أحيانا فيها fellowship training. في different implants I believe في لها أحيانا برضو separate training even though a lot of these are included in the core training لكن depending on the place. Currently بعضها yes you can get enough exposure with the exception probably of the craniofacial and oncology هذه ما في enough exposure in almost any program in the States to be able to practice after you finish the training only without a fellowship training بعدها. بس implants TMJ it depends on the scope in your residency. طيب بالنسبة للدراسة بالخارج بعض الطلاب بعد دراسة الماستر انصدم بدراسة المؤهل أنه لم يجتاز. أنا ما أعرف هل إذا القصد من السؤال إنه اختبار الهيئة إنه حضرت مثلا وحصلت على ماجستير في الخارج وبعدها جيت دخلت اختبار الهيئة ولكن واجهت صعوبة في اجتيازه. هذا المقصود. فإذا هذا المقصود طبعا هنا في عوامل قد تكون ما هي خطأك ما هي خطأ المتدرب. أحيانا قد يمكن تكون الأسئلة فيها مشكلة طريقة إعدادها ومراجعها وإن كان الهيئة الآن بتحرص على الأشياء هذه كثير إنه كلها بمرجع ما عاد صار وضع السؤال مفتوح لأي أحد. على الأقل بنسوي كده مع البورد ريزيدنس في اختباراتهم. ما أدري بالنسبة لاختبارات التأهيل قد تكون مختلفة ولكن ترجع برضو ل if you want send me an email في عندي يعني فايل مجمع الفول سكوب. If you covered that, you covered the full scope. ولكن أرجع أقول لك كماستر I don't know where you're studying the master. هل هو ماستر يعني بيعدك كأخصائي في البروفيشن ولا كاستشاري، علشان برضو تعرف where to stop in each one of those fields. بلاش إني أقعد أقارن بين الأماكن المختلفة، هي يعني سكوبس مختلفة حاليا زي ما قلت لكم. يعني إحنا البورد السعودي اللي هو يعني خلينا نقول يعتبر المرجع دحين، يعني مبني على نظام نورث أمريكا. في أماكن تشبهها وأماكن مختلفة عنها، حتى نقول ساوث أفريقيا تشبه كثير نظام البورد السعودي ونورث أمريكا. I think that is the scope of the practice that people know now و inclined to it now. ما يمنع إنه كل ما بنكتشف عن مدارس جديدة في الإيست which are looking forward to يعني their graduates يعني كمدرسة مختلفة عن اللي إحنا تعودنا عليها. And we'll wait to see what is different. And مو بالضرورة في مكان أحسن، كل واحد maybe have a scope معين ما يلو كذا. السعودية الماستر ديجري 3 سنوات بيكون في معظم البروجرامز اللي أعرفها 3 سنوات. طبعا في هذه اللي هو يقول جراحة وجه وفكين ما ينفع من غير طب بشري، هذا يعني هذا ما هو موجود. يعني أنا ما أعرف مين اللي يقول الشيء ده، بس يعني في النهاية إحنا في مجال علمي، في يعني فما هو open to everyone to say what they want. التخصص طبيعته إنه ما هو كذا، هذا طبيعة التخصص. فما يعني ما هو رأي لأحد. هذه تدخل في سكوب أكبر من كده، الوقت الحين ما يسعه. أحيانا التخصصات بينها boundaries وبينها يعني identity issues. فيعني حتى اللي يعني if they want to close a door، حتى اللي عنده شهادة بشري حيقول لا طب ما جاب الجراحة العامة، ولا لو واحد جاب الجراحة العامة يقولوا لا الخلفية في الجانب ده ما هي بالطريقة اللي نبغاها. ففي أبعاد تكون يعني ما هي علمية، ما هي professional. أنا as a matter of fact يعني a common answer I say، أنا كل اللي دربوني في البرنامج my training my residency training كلهم كانوا double qualified، كل الفول تايم كانوا double qualified. لكن كلنا إحنا اللي تخرجنا من هناك no one of the best we worked with حالات الأورثوغناثيك والTMJ كان one of the يعني he wasn't double qualified لكن he was definitely a better surgeon. هذا واحد and he's licensed to do all the surgeries just like them. النقطة الثانية مع إنهم double qualified none of them will get close to a cancer case. And that's good actually. That's good of them not to come close to a cancer case. لأنه they don't have enough training in that. Yet it's a fellowship training. It's a training on a special profession that will enable you to practice it. So shahada in by itself is not the issue. زي ما قلت لك يعني it depends on the one who's saying it. It's just not a scientific fact. No, it's not recorded to my knowledge. Oh, someone says it is recorded. طيب الحمد لله. طيب الله يعطيكم العافية. I think يعني كده we reached 4 o'clock. I just don't want to keep on going and the time maybe will close on us كده يعني.
مرة أخرى شكرا لك دكتور باسم وشكرا لحضورنا الكريم، وإن شاء الله نشوفكم جميعا، نشوف دكتور باسم في المحاضرات القادمة. شكرا لكم.
السلام عليكم.